Asthma. A problem with the lungs, presumably. And what you find in asthma, there's many things that can cause asthma, but most often Edgar Cayce talked about these subluxations in the second and third dorsals. Now we call that the thoracic area of the spine. It's in the upper part of the spine. These deflect the circulation of nerve supply and thus the blood to the bronchi and trachea. This causes a bronchial asthmatic disturbance. Notice it's the blood that's being disturbed from this nerve impulse. That's where we're going to come back to what we talked about earlier, imbalances in circulation as a source of disease. We saw that a little bit with migraine. Now we're seeing it with asthma. Here's another reading where he said there is in the dorsal area subluxation affecting the blood supply. At times this overflows. In other words, there's too much blood coming to the lungs, producing a congestion, which may be the basis for the inflammation. This produces then, by this lack of impulse, a spasmodic reaction of an asthmatic nature, either from cold or heat, too much sweets, or too much of the pollens or dust. So you see how these other triggers are like secondary causes. We know that these things can trigger, many different things can trigger asthma, but there's another level to the causation here, a primary level of where there's too much or not enough blood flow, usually too much blood flow to the lungs, and that's what sets up the vulnerability to asthma, Cayce says, in most cases. And where are we talking about here with the spine? There's the upper thoracic. See it over there on the right side? That's the area. And by the way, this is the model that the osteopaths were using and some of the chiropractors. For treating asthma, naturally, manual therapy, the use of the hands, either spinal manipulation or massage or something of that nature, would be right at the top of the list. Working with diet, because that's one of the triggers. Remember, diet can be a trigger, and we found this in our group. People that get their diet under control, their asthma symptoms improve sometimes quite dramatically, just from the diet, because that's a major trigger, particularly the sugars and those sorts of things. Calcidin, which I'll allude to later, which was an over-the-counter drug in Cayce's time, calcium iodate, and working again with applied spirituality. Now the Calcidin, I think it was available up into the 1970s from one of the major drug companies as an over-the-counter treatment, and Cayce recommended it for asthma and many other conditions. We actually had a compounding pharmacy make up some Calcidin, and some of the people found that very helpful. Cayce said it's a non-habit forming way of working with this, and it doesn't have the side effects. Sometimes these asthmatic drugs can have pretty horrendous side effects, and some of the people that came to our program were suffering from that as well. We wrote about this in a Venture Inward article. You may have seen that. We had 5 people come for our asthma pilot study. We had 4 of the people follow the treatment plan to some degree or other and reported improvement, and sometimes quite a bit of improvement. We had one person that really didn't get with the program because of their lifestyle and various things. And for the most part, again, the people that were able to do it showed improvement, either by quality of life, and most of the time we were measuring quality of life and how people reported to us as a pilot study, just to get a sense. We didn't have a way of collecting some of the other more technical data that you see in some of these studies. So we're just trying to get a sense, is this plausible or not? Is there something here? Now there was a study that was done that was a major study on asthma that was reported in the New England Journal of Medicine in 1998. And what they did was they took some people with asthma and they gave them chiropractic adjustments, these high velocity pop and crack adjustments, pop, 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 okay? And they had, that was one group, that was a treatment group, and then the control group, or the sham group, the group that was not supposed to get anything worthwhile, what they got was spinal massage and all sorts of soft tissue work. And when we looked at that study, what was interesting was the people that got both treatments had less symptoms, higher quality of life, and what was the other one, Doug? Symptoms, quality of life, less medication. 3 things that improved, and some of the physiology indicators didn't show much change, but the conclusion was, well, chiropractic doesn't work because it wasn't any better than the sham treatment. And when we looked at the sham treatment was all very close to being a traditional osteopathic treatment for asthma. Okay, a lot of soft tissue work. They weren't doing as much of the pop and crack. It was a different approach, and that's why Cayce liked them, by the way. So we wrote a letter to the New England Journal of Medicine and had it published, where we pointed out these methodological flaws that we needed to really understand. Is this really a sham treatment when you're doing these kind of manipulations? Maybe it's not. They published our paper. We had a much longer paper published in the Journal of Manipulative and Physiological Therapeutics, which is the top chiropractic journal, where we pointed this out to the chiropractors and kind of called on them to clean up their act a little bit and maybe get together with the osteopaths, see that whole thing of cooperation, and at least understand what the osteopaths were doing so you don't use some of their treatments as a sham treatment, see? We did the same thing with the top osteopathic journal, and this was just published actually in August, I think, where we called on the osteopaths to pay attention to this literature and have some input and not just let these things slip by, but to and be aware of their own literature, and particularly with regard to treatment of asthma. Now, when we go back to 1905, when we did our scholarly research, Charles Hazard, a very notable early osteopath, talked about the lesions that cause abnormal motor effects, both in arousing spasmodic conditions of the muscles of the bronchial walls and in the vasomotor activity that produces the hyperemia of the mucous membrane. Now let me explain a couple of those words. The vasomotor activity, that's what we've been talking about, where this blood flow changes from one part of the body to another. That's the vasomotor activity. And we're going to talk about that quite a bit more. Hyperemia just means too much blood. So when Cayce talked about that there are these nerve centers and that because the nerve impulse is impeded, it allows too much blood to come to the lungs, that's exactly what Charles Hazard was saying in 1905. I think Cayce said it probably 20 or 30 years later. So you can see that some of these things Cayce didn't come up with necessarily. Maybe he just was tapping into that literature and applying it. We've also found in the modern literature some studies where they looked at the airway mucosal blood flow in bronchial asthma. And so they're looking at the same thing. They're looking at the amount of blood that's coming to the lungs, and they're noting that there's something abnormal. And we actually went down to Mount Sinai Hospital and talked to one of these lead authors, a medical doctor there, about that hypothesis. And he doesn't understand why it is, but he's absolutely convinced that the basis for asthma is that it's a vasomotor problem. There's too much blood flow that produces congestion, and he says that's what asthma is about, and then these other things trigger it. Just like Cayce. Isn't that fascinating? Very recent, you see.